Welcome to E3 Rehab. I'm Dr. Mark Sertica, physical therapist. Today, I'm going to discuss the management of symptoms associated with the TMJ, and a lot of this information I'm going to pull from Dr. Sally Ho. The TMJ, or temporomandibular joint, is a synovial joint where the temporal bone and mandible meet. An articular disc separates the joint into superior and inferior joint cavities. You can feel the movement of both TMJs if you put your index fingers right in front of your ears and open and close your mouth. Everyone has a TMJ, so associated symptoms are referred to as TMD, or temporomandibular disorder. Now, these symptoms can come on after a traumatic incident, such as a car accident or blow to the face, or they can come on more gradually over time. In addition to jaw pain, people might report neck pain, migraines, headaches, ear symptoms, popping and clicking, locking, and other problems. Since the TMJ is heavily involved in talking, chewing, and swallowing, these symptoms can often be persistent, frequent, and debilitating. Because of its complex and multifactorial presentation, I definitely recommend seeking out a licensed healthcare provider. Some individuals might even need multidisciplinary care, including, but not limited to, a dentist, physician, and a physical therapist. Movement of the TMJ includes elevation or closing, depression or opening, protrusion, retrusion, and lateral excursion. The primary muscles are the masseter, which can be palpated externally if you clench your jaw, temporalis, which can also be palpated externally, and the medial and lateral pterygoids internally. Other muscles contribute as well, such as the supra and infrahyoids. Normal opening range of motion is between 40 and 50 millimeters, and functional opening is considered to be 35 millimeters, or the width of about 3 fingers. Let's address the first question that everyone wants answered. Why is my jaw popping? As we saw earlier, the articular disc normally sits nicely between the two bones of the TMJ and moves as you open and close your mouth. However, in some cases, referred to as an anterior displaced disc with reduction, that disc is sitting in front of the mandibular condyle. As your mouth opens, that disc relocates on top of the condyle, and you get that first opening click. Then, as you close your mouth, the disc displaces anteriorly again, and you get that second closing click. Sometimes this will progress to anterior disc displacement without reduction, where that disc stays anterior to the mandibular condyle the entire time and no clicking is present. In either case, individuals can be asymptomatic. The focus of rehab is generally on pain and function, such as limited mouth opening, because we can't always guarantee, unfortunately, that the popping or clicking is going to be eliminated completely. So I'm going to outline 3 categories for management, starting with lifestyle considerations. I'm starting with lifestyle modifications because if you don't modify the habits that are contributing to your symptoms, the exercises might not matter very much. And as I always point out during these discussions, you want to focus on changing what you can and not worrying too much about things outside of your control. So the first thing that you want to examine is your diet. Do you eat a lot of hard foods, such as almonds and carrots? Do you eat a lot of chewy foods, such as salads, bagels, and gum? Or do you eat foods that require large mouth opening, such as an oversized Chipotle burrito? This is a region that's worked a lot, so you want to take some load off initially. Switch to softer and less chewy foods, and take smaller bites. It's also generally recommended to start with chewing on the uninvolved side first. I'm going to start off by saying that we cannot maintain perfect posture, whatever we think that might be, all day long. However, if you notice certain positions, such as resting your jaw on your hands, especially after prolonged periods of time, exacerbates your symptoms, then that's something you're going to want to modify. The goal is to move often, and I'll provide some strategies when I discuss exercises. The next one is stress, and for me, it's one of the most important categories. Stress on its own can lead to increased sensitivity, but also as it relates to the TMJ, it can lead to unknowingly, clenching or grinding your teeth. So if you are someone who's under high stress and it contributes to your symptoms, you might have to find ways to modify that if it's possible. Less screen time, maybe spending more time outdoors, taking leisurely walks, meditation, deep breathing, whatever you can find that works well for you. And this kind of directly ties in with oral habits. So do you constantly chew on your fingernails or pens or something else along those lines that might be contributing to your symptoms? If so, that might be something that you need to be more cognizant or aware of and change it if possible. And finally, sleep. Just like stress, poor sleep quality or quantity can increase your sensitivity to pain, so you want to make sure that you're prioritizing your sleep and getting enough so that you feel rested each day, whatever that may be for you. Sleep position might matter, but I also recognize that it's extremely difficult to change your sleeping positions or habits. However, if you're always sleeping on your stomach or on a certain side, and that's contributing to your jaw pain, then that might be worthwhile trying to modify. Once again, focus on controlling what you can and be willing to work at it. Rehab isn't always an easy, quick fix. All right, so now let's get into the exercises. Exercise number 1, controlled mouth opening. You're going to put your tongue on the roof of your mouth and slowly open and close your jaw while staying within comfort. This is helpful if you have limited mouth opening or if you're getting pain with excessive opening. Exercise number 2, jaw wiggle. Put your tongue on the roof of your mouth and slowly move your jaw side to side while staying within comfort. Exercise number 3, cervical, thoracic, and scapular movement. Most TMD exercise programs also include chin tucks and scapular retraction. Based on the Rockabato 6x6 routine, as he's the most influential physical therapist in this realm, I think the important components here are frequent movement and movement variability, so these exercises can be easily combined. You can think about rounding your spine as you reach for the floor, and then extend back up, get a bit of that chin tuck, externally rotate your shoulders, squeeze your shoulder blades, and hold that position for a few seconds before repeating. So in addition to helping restore function and reduce pain, these exercises are a great way to check in with yourself regarding some of the lifestyle factors that I mentioned. For example, if you're constantly clenching your jaw and you don't even realize it, these exercises can help break that habit. I'd recommend 5 to 10 repetitions of each exercise every hour or 2. You want to do them frequently throughout the day, which is why they can be done in standing or sitting, which makes them convenient. This would also be a great time for a minute or 2 of deep breathing to aid in relaxation. So there you have it, some simple strategies for the management of TMJ-associated symptoms, focusing on things like lifestyle modifications and daily frequent exercises. If you liked the video, please help us out with this YouTube algorithm. Hit that like button, hit the notification bell, subscribe, and leave any questions or comments down below. Thank you so much for watching. Peace.